So some of the questions that you people ask, or that I ask the system: why do we have drugs to mask pain when they don't actually do away with the pain and the cause of the pain? Because we need to handle the cause. So why do we take drugs for the pain and not for the problem that caused the pain? That is one. Number two, what are the side effects of these NSAIDs? Side effect of number one of NSAIDs is they irritate the stomach wall. Now remember, we said in any health condition, for you to heal or reverse any health condition, you must fix the gut. Now NSAIDs and the steroids, they come in and mess up the gut because they reduce the thickness of the gut wall. When they do that, you expose the gut or the wall to the acid. Now you get gastritis. Now you get the perforation of the leaky gut. You cannot absorb nutrients adequately. So imagine if you've been taking painkillers for the longest period of time to manage pain in your knees, the arthritis, and then you end up having a messed up gut. This is to most women. Women, as you grow older, you become obese because of the estrogen. Some of our mothers are taking a lot of painkillers for the joint pains and arthritis. So they take these drugs, the meloxicam, for the longest period of time because when it's a cold weather, they feel the pain. But look at it this way. Your mother takes aceclofenac for the pain in the joints instead of changing the kitchen. And then she ends up suffering from a kidney disease that the doctor will tell you it has no known cause. We don't understand the cause. But the same doctor is the one who is writing a prescription for the painkillers in arthritis. And then the same doctor tells you that arthritis has no known cause. It's an autoimmune. And when he says it's an autoimmune, he has blocked you from asking questions because he just tells you, your immune system is actually targeting your own cells or your own tissues. When he says that, you are unable to ask him any further questions. So you now rely on him to do what he has to do with this autoimmune that he has just diagnosed you with. All autoimmune conditions hail from a messed up gut. They hail from a messed up gut. And the NSAIDs are actually causing a messed up gut. So will you be actually healing arthritis or making it worse? Hello? If rheumatoid arthritis is an autoimmune condition and autoimmune conditions start from a messed up gut and then you end up using a drug that will mess up the gut, will you be treating arthritis or will you just be masking symptoms as you actually open channels for more inflammation and arthritis? So yes, you mask the pain, but you open up a chance for more autoimmune conditions. Who knows, you might come out with lupus again. And then now we give you a steroid for lupus, which act the same way as the NSAIDs. So yes, steroids and NSAIDs mess up the gut, just like antibiotics, and that is crazy for you. Again, drugs, we say another group of painkillers is the antidepressants and the anticonvulsants. These are drugs that actually mess up the gut again, so more problems. And that's why antidepressants end up causing you depression and suicidal thoughts. Another one, these drugs called narcotics. The side effects of narcotics, some people will have a very dry mouth. Not actually some people. It's one of the side effects, the major one. Very dry mouth, the cracking mouth. You have difficulty in swallowing saliva because the throat is so dry. And then you have low motility of the gut. So therefore, contents of the stomach are stuck there for the longest period of time. So now you are abusing tramadol, but blaming red meat for intestinal obstruction and indigestion. And then you end up taking lactulose that will end up killing the nerves that supply the rectum. Therefore, you'll be reliant on lactulose to activate the nerves. Do you see how one problem just changes to another? So you took tramadol for the longest period of time because of your addiction, and then you ended up having gut problems, no motility, no flow, no peristalsis. You ended being constipated. You went back, took lactulose, and then destroyed the nerves that supply the rectum because you're now dependent on lactulose. Now you'll have to be taking a drug to help you empty the bowel. Aye. A drug after a drug, a drug after a drug. Well, again, the drugs that are called the narcotics, the painkillers that I told you, they don't change the pain. So now the ones that are called narcotics or the opioid analgesics, the morphines, the tramadol, the pethidines and all that, the ones that are high chances of abuse and misuse, these ones cause slow movement of the gut, so therefore constipation. So you can imagine somebody who has hemorrhoids and then ends up using tramadol for the pain. And then you end up having constipation. Now that hard stool rubs against that wound and you get more problems. Don't do that. And then they also end up getting you the euphoric feeling. You feel good about yourself, but you forget you had pain. And when they are metabolized and they go down in the system, the pain comes back. And now by the time you're taking the third dose, you're already becoming dependent on these drugs. And guess what is going to happen? They suppress your respiratory or your breathing centers. Now you have difficulty in breathing, and now we have to give you oxygen. And you know how much oxygen is expensive? That mask there. Some of your relatives died a long time ago, but they're still on that mask. And the bill is just accumulating. The bill is just accumulating. And I wonder, how is it possible that when you're sick, there will be always money for your bills? When you die, there will be money for hospital bills. But this money was not there when you were alive. It's just amusing how money comes in when people get sick and there's a hospital bill that has to be offloaded. So you suppress the respiratory centers, you have the gut problems, and now every problem that comes in as a side effect of the drugs that you're using for pain. When they were not actually destroying the pain, they were actually masking and changing the way you perceive pain. And these drugs are given to cancer patients, like morphine is given to cancer patients to just make them feel the euphoric feeling. They forget they have cancer, they forget they have the pain, and now they're just in that euphoric state, and they become so addicted to these drugs. And then now they give you morphine, but they give you a drug for constipation because it will cause you constipation. And now they give you supplements because this morphine messes up your gut, so you cannot absorb nutrients, so that you have to need a supplement. And now they have to give you oxygen for suppressing the respiratory centers. So you can imagine. So when you go through that hospital bill, you're looking at the therapy versus fixing side effects. You're just wondering. Sometimes and I wish you guys just knew. When you go through that checklist or that bill, and you're busy looking at the drugs area and you're seeing how they charge in theater and all that, if only you knew that the drugs that are going to be used for therapy are very minimal. These other ones are just going to counter the side effects. You will not trust hospitals. But again, hospitals are coming in handy when we have these emergencies, right? So I'm not here to substitute your doctor's advice. I'm not here to demonize hospitals. No, I know the role that hospitals play in healthcare is a primary role. However, I'm saying for us to ease the burden in the hospitals, we must ease the unhealthy foods in our kitchen. Just change that. Okay? Yeah, just change that. Now, on to the last thing that I wanted to talk about here is the anabolic steroids. The steroids that people inject themselves so that they can grow muscles but end up having erectile issues. Those steroids don't work in this dimension. What they do is they increase protein synthesis in the cells. When you increase protein synthesis, you bulge the muscles, you grow big. But as we go through this, I would like you to actually enjoy this and just listen to how they get you big and fat. That's why that bodybuilder is not built, he's just fat. Just a fat guy with a big tummy and lifting heavy, hurting his joints, and they end up suffering all these conditions. You've seen them. Like there's a guy from the US who used to eat everything and had these big muscles, and he was actually saying no, and then he got an heart attack, and now he starts with K. The word is K. His name is K, and then the next name is Muscle. Well, for those of you who don't know him, he's called Kali Muscle. I used to watch Kali Muscle's videos and I got so upset about this guy drinking all this soda and saying all the crazy stuff and then popping the pills for steroids. And then now, he got his whips when he got the heart attack. Hey, and now if you see his videos now, he's busy trying to tell us how bodybuilding is crazy, how steroids are bad and all that. We know you've walked through the journey, so okay, you're telling us this. But do you sometimes go back to your videos and think, what were you doing? Are you crazy? And by the way, one side effect of the anabolic steroid is psychosis. So sometimes you might think this is a bodybuilder trying to train you. You're wondering, why is he training me leg day the whole 5 hours? I'm doing leg day here. He is in his own imagination. So when you have a fat bodybuilder, don't even walk near that gym. If a fat bodybuilder is actually your gym trainer, run. A gym trainer is supposed to be lean and he has to understand muscle physiology. He has to be patient. He has to be consistent. He has to be disciplined. And discipline involves the discipline of diets. Some of you are trained by fat gym trainers with a pot belly, with a buttock and the hips, full of estrogen, drinks alcohol, eats all these crazy foods and bananas in the gym, and drinks energy drinks and protein shakes, and he still trains you to be fit. What are you doing in that gym? Go there with your own schedule and train with your own schedule. Let him be there with his pot belly. So these are the side effects of anabolic steroids. The ones that you use to boost your muscle and all that. Zamunda, I see you. Welcome on board. I see you, bro. 1, acne. And realize this. When you walk into that gym and you see the gym trainer, most of them have acne and they have a very oily skin, right? Just be observant. You'll see they have acne. Where are they getting the acne from? Number 2, you're going to become so moody. The mood swings are there. And the psychosis is there. So you can imagine, you're thinking this guy is training you, but this guy is actually going crazy. This guy is this guy is actually exercising his psychosis on you, training you for leg day for about an hour. You're wondering, hey, should I do a leg day for an hour? What is wrong with my legs? I'm not going for any competition. He's exercising his psychosis on you. Number 3, very high appetite that gives them weight gain. Now listen, you can easily see these things when you walk into a gym. Most of the people who have been in the gym for the longest period of time, they are fat, they're obese, they have pot bellies, and they eat 5 meals a day. They actually say it on videos that I eat 5 meals a day so that I can get, because my metabolism is so high. Now they defend using metabolism. Because my metabolism is super high, so I eat 5 meals a day. Because I need to lift heavy, I eat ugali before I come to the gym. So they're eating 5 meals a day, still snacking in between. And then they want to train you on how to have a fit body. You will never have that fit body. The only thing they will train you is how to pop pills for steroids, because they are in business selling those steroids. They will also train you how to drink the protein shake, because they're also selling those protein shake. And then they are the ones who stock the gym refrigerators with soda, with energy drinks, and with bananas. Side effect number 4, sleep disturbance. They never have sleep. Side effect number 5, depression and anxiety. Remember we talked about mood swings? Depression is part of that. You ask yourself, after a body, have you ever seen a successful bodybuilder after their life of bodybuilding? Now we have stroke, the risk of stroke and heart attacks. They get it all the time. The anabolic steroids, trying to boost what the body does not want. The body can do its own work. By the way, if you just train well, you fast, you eat high protein diet and the fats, you will have the body that you want. Work for it. Be patient. Do not force the body. Now, another side effect is liver failure. We cannot forget about the liver failure and then the overload that is coming with the kidney, because the kidneys are actually retaining a lot of water. When they retain a lot of water, that is hypertension, that is a heart disease, that is a stroke, that's a kidney disease, which is going to bring you more problems like anemia. Now, reproductive health issues. I already told you, in men, you will have shrunken balls or the testicles shrinking. Now you have this big body, but your manhood is very little. So how will you be able to satisfy these ladies? And they come with the anxiety because you have these muscles and a very well-built body. These ladies are thinking you are a beast. So in men, reproductive health issues. Number 1 is low sperm count. Because you aggregated, you actually hastened the production of protein. And all this protein is actually being pumped into the muscles for you to grow big. But then the sperm count goes down. Number 2, gynecomastia. Men grow the boobs. Now, we also have infertility because of the low sperm count, right? And then we have shrinking testicles. So these are basically the side effects of the anabolic steroids in these people. And you can easily see them when they are going on the stage to flex. Yeah, when they go to the stage to flex wearing those strings, you will easily see what I'm talking about. Now, in women who take steroids to boost their muscles, 1, menstrual irregularities. Again, risk of cardiovascular diseases, hypertension, stroke, heart disease, and all these things. And then they end up having an enlarged clitoris. There's another one called hirsutism. Hirsutism is basically a lady growing hair all over. Hirsutism. You've seen ladies with the beards. That's also PCOS because of high progesterone, which can be converted to testosterone, and then ladies start to grow the beards and the hair all over. Okay? And then they deepen their voices. Vipi mzito. That lady talking to me like Mzito, like literally. What are you saying? And then now you see in the men, their counterparts, they have enlarged boobs and the buttocks. But in these ones, they have flat chests. Now you wonder, you are who? You said you are Lynette or who? Eh? And you can easily see these things in people.